In the following WBT, we will discuss and demonstrate different techniques for successful IV insertion in patients with difficult veins. Incorporating these tips and techniques into practice have proven beneficial for caregivers with varying years of experience who are attempting IVs on patients with challenging or difficult to find veins. Hi, my name is Chad Denny. I'm an ER nurse at Ascension St. Vincent, Indianapolis Level 1 Trauma Center. I've worked in the ER since 2001 and I've been a clinical supervisor since 2010. With the increasing population of patients who present with difficult veins and the minimal IV experience received in nursing clinicals, we identified the need for education to assist caregivers with more efficient and successful IV starts for patients presenting with challenging veins. The IV class was submitted to Ascension Launchpad program and was selected to receive funding to support an IV class trial. With the support of the Ascension Launchpad program innovations team, we were able to trial the IV class and one-on-one coaching where real-time feedback was given to nurses who had from a few months to several years of experience while starting IVs on actual patients. Reoccurring obstacles to successful IV starts were identified but easily resolved with minor changes in techniques. After receiving the feedback and implementing the suggestions and techniques from the IV class, clinicians demonstrated immediate improvements and successful IV starts dramatically improved. There was a 76% reduction in IV team orders in the 3 months following the IV class and one-on-one training. Some of the nurses who went through the IV class are now the go-to people for difficult sticks on their units. Because of the positive impact of the IV class, we want to make the information presented and discussed in the IV class available to all clinicians. This video will show the recurring points that we discussed in the IV classroom and reinforced with the practice in one-on-one training. The goal of this WBT is to share with you the tips and techniques that were demonstrated reliable and successful obtaining IV placements in patients with difficult to find veins. Developing proficient IV skills and efficient IV placement aligns with the Ascension quadruple aim of better outcomes, improved patient experience for those who give and receive care, all at a more affordable cost. There are 5 key points that dramatically improve successful IV insertion rates that we will discuss and demonstrate. So let's get started. There are 5 key points that you want to take away from this WBT. Utilizing and practicing these 5 key points will ultimately lead to more successful IV starts. We will review each one of these in more depth one by one. The 5 key points. Using the blood pressure cuff as a tourniquet will assist in finding a vein when you're unable to find a vein with a standard tourniquet. Pushing the blood down the arm with an alcohol pad will help engorge the veins. Stabilizing the vein with skin traction. How many times do you hear your patient say, "I have rolling veins"? We will show you how to prevent the vein from rolling by stabilizing the vein with skin traction. Correctly holding your needle. You'll want to keep your needle insertion angle low. This will decrease the chance of blowing the vein when inserting the needle through the bottom of the vein. When inserting the needle, get your flash, advance the needle 2 to 3 millimeters more, lower the angle, then thread your catheter off. I can't stress enough how important all of these play in assisting with successful IV starts. We will discuss each of these key points more in depth. Before putting on the tourniquet on the patient, there are a few things you want to do to set yourself up for successful IV starts. First, be confident. Go in the patient room and introduce yourself. Hi, my name is Chad. I'm one of the nurses here in the ER, and I'm here to start your IV today. Don't walk into the room and say, with your head down, "I'm here to try to get your IV today." Be assertive. Go in with confidence.